Okay. So, Bismillahirrahmanirrahim. Assalamu alaikum. And a very warm welcome from my side from AS Global Healthcare Academy. So, I would like to start with a brief introduction of myself. My name is Afifa Saghir, and I am a Pakistani graduated pharmacist. I graduated in year 2014 from University of Peshawar. Then in year 2023, I cleared my Australian registration exam that was called as CAPS. And then after clearing my exam, I successfully secured a sponsorship and invitation from Australia. And after that, I started the forum with the name of AS Global Healthcare Academy. When I started this forum, I had in mind that I have to give counseling services, career coaching services, particularly for Pakistani pharmacists, because as a Pakistani pharmacist, I felt that there is a lot of things that are needed to be done in this particular area. And the particularly in our community, the guidance, the mentorship from our seniors, from our colleagues, it's negligible. So I started with this goal, but ultimately, with the passage of time, Allah Pak has been very grateful for me. So it expanded globally. So right now, with AS Global Healthcare Academy, we have a lot of international pharmacists as well. We have pharmacists from Egypt, we have pharmacists from Sudan, we have pharmacists from Nigeria, we have pharmacists from the UAE, and a lot of countries. Now, mostly the pharmacists that we have, they belong to the countries who are you can say development in particularly in the field of pharmacy development wise, they are behind. So they need to go forward, they need to go for some registration exams in order to pursue their careers in international countries like in the Gulf belt, or in the international English speaking countries like the USA, Canada, Ireland, and Australia. Okay. So now I started this forum and I was all alone. And now it's been 2 years since AS Global Healthcare Academy. Okay. Someone is saying that please talk in Urdu. Sorry, I cannot conduct this webinar in Urdu because we have international students as well. So if there will be no international students, I would have conducted in Urdu, but I have to keep in mind the international students as well. Okay. So after 2 years today, we as AS Global Healthcare Academy, we have coached, we have counseled 150 plus pharmacists, and a lot of pharmacists, they are working in their dream countries. Okay, so this is the forum for all of the pharmacists globally. So if you are a pharmacy student, if you are a graduate, if you are an experienced pharmacist, our doors are open for you regarding for career counseling, any type of coaching services, any type of opportunities that are available with AS Global Healthcare Academy or globally anywhere in this kind of forums. Okay. So I will like to start this webinar officially. And second thing, I would like to mention that I have moved to Australia and I'm working in Western Australia as a trainee pharmacist, and my trainingship will be completed. Then I will be granted the registration over there. So I will take all of your questions by the end of this seminar. And if you further have any queries, so the details of my contact, they are with you. And if you still need, if I'm not available, so you can also contact Rizwan as well. So he's the core member of my technical team as well. Okay. Now, what was the background behind starting this AS Global Healthcare Academy? So we need to know when we are graduating. When we are graduating, like when we are in fourth year and final year, those are the very important years at which the pharmacists, they should get this career counseling, particularly in the countries with where we belong. So we need to know at fourth year and final year level that what is the scope of pharmacy. Okay. Now I have experienced a lot of pharmacists who are graduated and who are working in certain industries or some community setups, but still they say that, ma'am, we don't have the scope. Okay. So I would like to clear one thing, that our subject is such a technical and it is such a worded subject that as Pharm-D, just with Pharm-D degree, we can excel our career in anywhere in the world. Okay. So this is the subject with which you don't need subspecializations or MPhil or PhD or these kind of you can say time taking degrees. Okay. But with this subject, if you know that what is the practical implication of pharmacy, then you will be able to decide that what I'm going to do after I'm graduate. So now all of the things that we study in our pharmacy, we study with respect to books. And all of us, including me, we studied just to pass the exams. We did not ever think about the practical implications of pharmacy. So with when once you are associated with AS Global Healthcare Academy or any kind of international forum, you will come to know that what is the essence of our degree. And if we correlate our concepts with the practical knowledge, our degree has a scope that is beyond expectations. Okay, so particularly because I am also working in Australia, so particularly my forum and our forum, it is emphasizing on what it is emphasizing on devising the career pathways for pharmacists regarding registration in foreign countries. So if you are aiming for any Gulf country, if you are aiming for any English speaking country, so AS Global Healthcare Academy is the forum with which you can contact and you can get all of the required information, starting from the documentation, then towards your exam, and even after exam, what are the steps that you need to do to get a job and move to that particular country. Okay, so our goals basically they emphasize on the first and important thing is the career counseling that is lacking with the most of the Pakistani pharmacists and overall the pharmacists from the subcontinent and the pharmacists from the Gulf belt. Now we provide the career counseling. First of all, we understand the dynamics of every student, because every student they have their own kind of dynamics, they have their own scenarios. Then after understanding their dynamics, we provide them different options. Yes, this is the country, this is the country, this is the country. Then regarding that country, once the student selects a particular country, then we provide the consultation services that yes, for this country these are the steps that you need to perform, and after that you will be eligible to apply for the registration process in that country. Then the third and the most important thing, that the communication techniques. So communication techniques are very important. Now when I was applying in Australia for the for the securing of the traineeship opportunities, so at that time I felt that we as pharmacists, we haven't been taught in our 5 year degree that what is the importance of communication. So our communication is very important, whether we are applying for some interviews, whether we are talking to the doctors, whether we are talking to the nursing staff, or whether we are talking to the patients, or whether we are talking to our employers. So these communication skills are very important. So we also when you are associated with AS Global Healthcare Academy, so we also work on your communication techniques. Then coming towards the most important part, that if you wish to work in any international country, so for that to be eligible to work in that country, you need to pass that country's registration exam. Now, most of the students, the problem with us is that we rely on study materials. We look for that someone will give you something prepared and we just memorize it. And that is the the most important drawback of us. Because we emphasize on what? We emphasize on memorizing things. We don't emphasize on understanding things. So there is a very fine line difference in between understanding things and memorizing things. So once you start to memorize the things, they are going to, because pharmacy overall, it's a very tough subject, and it is, along with being tough, it is volatile. So if we memorize the things, they are going to be whoosh, poof out of your brain in a very shorter period of time. But if you understand the questions, if you understand the concepts, so they are going to be there with you throughout your professional career. Okay, so the international exams, how the international exams are devised, how to study for the international exams, what is the syllabus for a particular international exam, how much time do you need to prepare for an international exam, and then how to study, what kind of questions are there, everything that is provided by our AS Global Healthcare Academy. Then once the students they are done with their exams, they have cleared their exams. Now coming towards the most crucial part, where most of the Pakistani pharmacists they get stuck, that they clear the exam but they don't know what to do after clearing the exam. And I have seen this with a lot of pharmacists from Pakistan who have cleared their Australian exam, and still they are sitting in Pakistan, and they are just spreading these things that no, Australia has is not giving invites, there is saturation of pharmacists. So that is not the thing. That is the problem, that we don't have the exact knowledge, we don't have the exact pathway, that which pathway to follow in order to move to Australia. Okay, like if you are sitting in Pakistan, and if there is an employer thousands of kilometers away in Australia, sitting in a certain corner of Australia, and then how would he know that you have cleared your Australian exam? So you need to go and you need to apply for the opportunities. But before applying for the opportunities, your documentation should be complete. So most of the pharmacists, they don't complete their documentation, and then they apply for the jobs, and then they straightforward they get rejections, or they even don't get any replies. So these are the things that I'm going to explain in the upcoming webinar. Then if you are going through the documentation, and if you also need the visa processing support, so most the countries that I have enlisted with me, these are the countries whose visa processing and all of those processes, they are elaborated with us. We have collected all of the information, and that is the genuine information from the genuine sources. So this will be very cost effective and time saving for you, and it will be guided type of counseling and coaching for all of you. Now, coming towards the countries that we specialize in. So we specialize in the international countries that are that is Ireland, Australia, New Zealand, Canada, USA, UK, Gulf countries, and the European countries, rest of the European countries. So let's talk about the most commonly asked question from me, that is the PSI. And PSI exam, it stands for the Pharmaceutical Society of Ireland exam. And PSI, it is nowadays a very hot favorite topic of pharmacists from the subcontinent region, because recently PSI, like 1.5 or 2 years back, Ireland opened its gateways for the international pharmacist. Now, with PSI, there are different steps and different procedures that will help you to get your registration in Ireland. Now, for the PSI, the first thing that is what that you are eligible as a fresh graduate. So you don't need any post qualification experience in order to be eligible to apply for the registration process in the Ireland. So as a Pharm-D graduate, fresh graduate, you can apply. Now, what are the steps for the PSI exam? So PSI exam, it recently changed all of its steps and all of its processing I think so in April, March end or April start of 2025. Now, what are the steps? So first of all, you need to apply for the document assessment. You will go to the PSI website, you will download the required forms, and you will collect all of the documents from Pakistan, from your university, from your college, and you will submit it to the PSI website. And then PSI will review
Assalamu alaikum. I would like to interrupt in between. Dr. Afifa, you are mute, I think.
Hi, Dr. FIFA, how are you? Your voice has been gone.
Assalamu alaikum. Madam Afifa, your voice is mute. I think there's something technical problem, maybe.
I think there might be a problem with Dr. FIFA's internet.
Okay, I'm so sorry. There was some problem with my internet. So can you guys hear me now?
Yes, madam, you're audible.
Thank you. Thank you so much. So I was telling you about PSI exam. Okay. So once you get your assessment from the PSI, then your documents will be sent towards the holistic assessment. So most of the students, they ask about that, what is the holistic assessment? So holistically, they will the PSI body, the regulatory body, they will assess your documentation. They will send your documents to the hiring authorities, to the prestigious institutes like the Cork Institute, Dublin Institute, and from there the prestigious people in the pharmacy, they will see your Pharm-D syllabus, your internships, your everything that is in practice in Pakistan. And then after holistic assessment, and remember the cost of holistic assessment is 1,000 euros. So now total is what? 1,500 euros. So after holistic assessments, there can be two outcomes of your application. So if your post qualification experience is good, and if they are satisfied that after your post qualification you have done enough time in community, clinical, or hospital settings, so they can place you in what? They can place you in pathway A. So for pathway A, you don't need to sit in any exam. You will be granted a direct registration. So you need to just clear the language exam, that can be IELTS or OET, and you will submit the result of that IELTS and OET, and then you will be granted what? Then you will be granted the pathway A, through which you will get the direct registration to work as what? To work as a registered pharmacist in Ireland. But as per my experience, we as Pakistani students, our syllabus, it wasn't redefined, and it wasn't uploaded till from it was updated last 2011. Now it is recently being updated in 2025. So there is a huge gap in between these two updates. So as per our previous syllabus that was updated in year 2011, 90% of the Pakistani pharmacists, they are placed in pathway B. Now if they place you in pathway B, so they need to do what? They need to assess your knowledge about what? About therapeutics, about clinical, about all of the pharmacy. So then you will have to go and you will have to book an exam. So the exam, it costs what? It costs 3,000 euros. So if you go in pathway A, you will only need to pay, you will need to pay 1,500 euros. But if you go to the pathway B, then you will need to pay what? Then you will need to pay 1,500 plus 3,000, 4,500 euros. And if you go to the pathway B, then the exam, it is very tough. It is one of the toughest exams of pharmacy. But once you clear your exam with shining colors, then on the basis of your result, so the people who have gotten 90% plus marks in the PSI exam, they were immediately granted registration, and immediately they were handpicked by the employers. Okay. So the exam, if you go into the pathway B, the exam, it really, really matters. Okay. So this is the overall process of the PSI. Now with PSI exam, remember PSI exam, it is conducted twice yearly, once in the April end or May end, and then second in the October end or November end every year. Now, before the process was changed, so PSI exam was conducted online. But with the recent changes in the PSI procedure and everything, now the PSI exam, it is conducted on site. So if you are to appear in the exam, you need to travel to Ireland on the short visit visa, and then you have to appear in the exam there in Ireland. Okay. Now, coming towards the second country, that is Australia, and that is a very frequently asked question from me. So now for Australia, till last year, November 2024, the exam was called as CAPS. Now the Australian exam, it has been changed, and till now two sessions of OPRA, two exams of OPRA, they have been conducted. Now OPRA exam is for Australian registration, and with OPRA, if you have cleared OPRA, you can also apply for the New Zealand registration as well. Now, the OPRA, it is conducted three times per year, and it is conducted in Pakistan. So March, July, and November every year. Now with OPRA, first question, that why did they change from CAPS to OPRA? So the problem with CAPS was that the recalls and past papers of CAPS, they were available everywhere. and they were single lined questions, and they were very easy for the students who are sitting in the exam to memorize, and then they replicate those questions and they circulate with their colleagues and juniors. But what happened, most of the pharmacists from the subcontinent, they memorized those questions, and after memorizing those questions they cleared the exam. After clearing their exams, they launched in Australia, but with zero understanding, with zero knowledge. And now, when they are working, when they are training, so what happens? They have an Australian qualified pharmacist in the pharmacy, they have a qualified pharmacist from Malaysia, and have a qualified pharmacist from the subcontinent. Now, those pharmacists, they studied and they understood the things, and now they can communicate better, they can solve the problems better. But we, as the pharmacists from the subcontinent, we did not understand the concept, we just memorized, and ultimately we failed to prove our capabilities over there. So that is why now they have evolved the exam towards Oprah. Now, Oprah questions, they are, some of them, they are single line questions as well, but most of them, they are what they are now, long questions, and they are interrelated. So sometimes they interrelate biopharmaceutics with clinical, sometimes they try to interrelate the clinical concepts with the medicinal aspects. So now this exam, it has been evolved and it is getting a bit tougher as well. Now, for Australian exam, the eligibility is simple. Pharm-D, fresh graduates can apply. Then the steps are almost the same. So after document assessment, so the cost of document assessment is around 810 Australian dollars. Then comes your exam. So you will have to sit an exam, and the cost of exam is in between 2210 or 2290 AUDs. I'm not sure about the figures, but it is around 2200 something. Then after you clear your equivalence exam, now there comes the crucial step and the most important question that I have been facing for last 2 years. Now, once you're done with your equivalence exam, then you need to appear in the English excellence. So you can go for PTE, you can go for IELTS, even you can go for CELPIP as well. Now you have your English excellency in your hand, you have your exam, the equivalence exam certificate in your hand, Oprah or CAP certificate in your hand. Now now comes the most crucial step. Now the students in Pakistan, they say that yes ma'am, we have cleared caps 2 years back, we have cleared caps 3 years back, and we haven't got an invite. Now this is the step which will define you. Now the students, they go and they start applying with their cap certificate and their English certificate towards the trainingships that are offered in Australia. But this is something like that you have a Pharm-D degree in your hand, but you haven't gotten your registration from any pharmacy council of Pakistan. Now no one will, even in Pakistan, no one will give you the job because you don't hold a valid registration. So how can you expect that someone in Australia will offer you a sponsorship along with job? Because after the exam you need to register yourself with EFRA. So EFRA is the provincial registration, and it is the registration body of all of the healthcare professionals. So once you're done with your exam and your English excellency, then you have to register yourself with EFRA. And if you hold a valid EFRA registration, and if you apply for jobs, apply for trainingships, then you will be what? You will be granted. Even if you get a rejection, then you will be given. But for the pharmacists who apply with what? Who just apply with their CAP certificate and English certificate, then they are not even answered. So EFRA is the most important key after the exam. Now, once you get your traineeship secured in any particular area of Australia, then you will move towards Australia, and there you have to complete the traineeship. After completing your traineeship, you will have to sit in an oral exam, and once you have cleared your oral exam, then you will be given the full-fledged registration of Australia as full-fledged registered pharmacist to be eligible to work in Australia. Okay. So always, any of the pharmacists in your circle who have cleared their exam and who are the cost of EFRA is around 550 US dollars. EFRA, it costs in US dollars. Okay. And one thing, if anyone in your community nearby you is facing this difficulty that I have cleared my exam but I'm not getting invite, so these are very important points. The third thing, that most of the pharmacists from our country, they do what? When they launch the visa application, they pick what? They pick the cities like Sydney, Melbourne, Canberra. Now, these are the main cities of Australia, and there already Australian qualified pharmacists, they are frequently applying for traineeships. Now, there you will face a lot of competition. So, I always counsel the students to pick the rural side of Australia. Once you pick the rural side of Australia, in the rural side of Australia, most of the Australian qualified pharmacists, they don't usually prefer to go. So that there is a lot of, you can say, vacant positions and a lot of window for us. Okay, and there on the rural side, the pays are also better, the cost of living is also less. So this rural side, it is very, very promising. So these are the most important points and some techniques that I would like to share with all of you people in order to do what, in order to secure your dream job in Australia as a pharmacist. Now, coming towards the next country, that is called as the USA. And the USA, final registration exam of USA, it is known as NAPLEX. Now, for to apply for registration in the USA, you don't need any particular post qualification experience or anything. So simple fresh graduates can also apply. But before I start telling you about the USA, keep one thing in mind, that for USA, even you need to, first thing that you need to do what before applying for the registration process for the USA, you need to clear the TOEFL, English language exam. And the USA, they don't accept the TOEFL that is being conducted from Pakistan. So if you need to apply for the NAPLEX or registration process, so you need to go to the USA to sit in the TOEFL exam. And once you have gotten your enough sufficient scores in TOEFL, then you are eligible to apply. Then you will start your document assessment. After your document assessment, and once you are granted a successful document assessment, then you will have to sit in the first equivalence exam, that is called as the FPGEE. Okay, then once you are done with your FPGE exam, then for FPGE again you have to go to the USA. After after FPGE, then you have to complete an adaptation period or a trainingship program. And after you are done completing your trainingship program, then you will have to sit in the registration exam, that is called the NAPLEX. And again, NAPLEX is one of the toughest tests of pharmacy. Okay. Now, once you're done with your NAPLEX, so then you have to apply, then you have to clear the state law exam. So like if you are applying in the state of New Jersey, so you have to clear the New Jersey law exam as well. Then after clearing your law exam, then you will apply for registration. And yes, if I talk about with respect to the best pays, so US pharmacists, they are the best paid pharmacists throughout the world. After US, it comes towards the Switzerland, and then the third best paying countries is Australia and Ireland. So the after test tax deduction, the overall salary of Australian pharmacists and Irish pharmacists, they are almost the same. Okay, so these are the processes for the US exam. And once you are registered in US, yes, it is the dream country for most of the pharmacists. Okay, and if anyone has any question, please keep your question written with you. At the end of the session, I will take a detailed question answer session. And if someone forgets to ask a question, they can ask me personally as well. But keep in mind, whenever you approach me, just a brief introduction so that I should know that who I'm talking to. Okay, so then I'll be able to guide you properly. Okay, now coming towards, and the cost of the US process, it is not very high. It is around 8 to 12 lakhs. But the cost of the visit visa, multiple visits, and staying there, it gets higher and higher. So till now, I have only coached two students for the NAPLEX exam, but both of those students, they were the residents of the US. They were there on the spouse visa. So things were easier for them. So if you have family there, if any one of you is going there on spouse visa, or if anyone is there on student visa and now want to pursue for registration process, it is going to be easier for them. But for the people from Pakistan to apply for visit visa, so that is a 50-50% chance. So no one can guarantee you that you will get the visit visa to go and appear for TOEFL. So then visit visa, it comes with costs as well. So just keep all of these things in your mind before deciding any of your desired country. Okay, so every country, remember, it has what it has its own pros and cons. So according to your budget, according to your dream, and according to your circumstances, you need to weigh those pros and cons and then make an informed decision. We as AS Global Healthcare Academy, we provide you all of the required information, and then you will be able to make an informed decision. And the final decision, obviously, it depends on your wish. Okay, now, coming towards the Saudi and rest of the Gulf countries, all of the procedures for most of the Gulf countries are almost the same. Now, to work in the Saudi as a registered pharmacist, you need to clear the SPLE exam. But now, with the Gulf countries, there comes a barrier of experience. So, if you wish to work in Saudi, you need what? After Pharm-D, you need 1 year post qualification experience. Okay, then the steps are almost the same. Once your experience is complete, so then you will apply for document assessment, that is called as the data flow. So the terms can be different, but the procedures are almost the same. After your data flow, then you will be sitting in the equivalence exam, that is called as the SPLE exam. And SPLE exam, they have a lot of prometric centers throughout Pakistan. Now, again, I'm telling you that like if we go 3 4 years back, so people for the who were applying for DHA, MOH, SPLE, these types of exams, they had some notes in their hands and they just memorized everything and they sit there and they cleared their exam. But now these Gulf countries, they have also revolutionized their pattern of their exam. Now the particularly SPLE, if you book your SPLE exam, even you have to pay the fee of SPLE in US dollars, because they get the NAPLEX people to make their exam. So now SPLE, it is getting tougher and tougher day by day, and a lot of long clinical scenario type questions are there. So you need a thorough understanding of the concepts before sitting in the exam. Okay, then once you're done with your exam, then you can go for registration and SEHF and everything, and then you will be granted an ikama from the sponsor, and then you can work in the Saudi. Now, a lot of students, they ask that what is the scope there. A lot of people are saying on Facebook that there is no scope and so and so. Now, everybody tells their own side of story. I'm going to tell you what I have experienced in last 2 years. So in last 2 years, I have coached almost 20 to 25 plus pharmacists with for SPLE, and out of those 20 to 25 pharmacists, 10 to 15, they have cleared their exam in their first attempt, and most of them, they have moved to Saudi. Now, as per their recommendations, there is, yes, there is a lot of competition there. But if you get a very good opportunity there, so their chances of growth are also there. But remember, for all of the Gulf countries, they are not as promising as the international English speaking countries like Ireland, Australia, New Zealand, Canada. But still, if you are a pharmacist who is having certain budget constraints, so budget constraints are one of the most important concern from the pharmacist that belong to our belt. Okay, now if you're having budget constraints, so consider Gulf as the first step towards your career journey. So Gulf exams, they cost less. Overall cost is around 3 to 4 lakhs in between all of the Gulf exams. Then go there, secure a job. Obviously, the pays are much better than that of Pakistan. Secure a job, secure international experience, and then apply for your dream country. So this could be the also a pathway for all of you if you don't want to directly jump with a lot of budget and everything. Okay, and with Gulf countries, the waiting time is also lesser as compared to the English speaking countries. So all of these things, keep them in mind. Then you can make any kind of decision that you want. Now, when we talk about the DHA, MOH, and HAD, that is, these are the exams that are required to practice in the UAE as a registered pharmacist. So all of the steps are almost the same, cost is almost the same, just the difference that to work in the UAE, you need 2 years of post qualification experience. Okay. Now, coming towards the next country, that is called as Canada, and the Canadian exam is called as PEBC. Okay. Now,
Yeah,
just like same. Sorry. Okay. So now again, you as a fresh graduate can apply. And Canadian documentation, it is also a very tough kind of documentation, and the exam is also tough. But the waiting time and the cost, it is higher. So it goes around, I think so, it goes around above 10 to 12 lakhs. Okay, so the rest everything is the same. But as per my experience, a lot of people from Canada, I have coached two pharmacists for Canada as well, and they are now this they are stating that now Canadian society or Canadian pharmacy market, it is more and more emphasizing over what it is more and more emphasizing over the retail and community roles of pharmacist. Whether if we on the other hand, if we see the practices in Australia, in USA, in the UK, and in the Ireland, and in the European countries, nowadays the practices, they are more and more emphasizing on the clinical roles. So this is a huge difference. So if you have family or something like that who can support you there to work in Canada, then consider Canada. But if you don't have those kind of support systems, then I would recommend that instead of Canada, consider some other country that has a greater you can say clinical and hospital side scope for you. Okay, and I will talk about the scopes as well. Okay, now before coming towards the concluding remarks, I would like to tell you all about a little bit about the UK. Now, I haven't stated UK in this presentation is that because in the UK, the first problem is that the our Pharm-D, it is considered as what? It is not considered as a 5 year program. Our Pharm-D, it is considered as what? It is considered as a 4 year bachelor degree. Rizwan, can you please mute the mics or just simply remove the people, okay? Because it's already interfering a lot. Okay. So when you apply for your documentation in the UK, then you will be granted, you will apply for the documentation with the GPHC. Then GPHC will give you what? GPHC will give you a certificate that yes, your degree, it is verified, but it is considered as a 4 year bachelor program. Now you are eligible to get admission in the UK in the universities that are offering the OSPAP program. So OSPAP is a 1 year degree program, and then you will have please, guys, can you mute your mics because it is interrupting for rest of all of the participants. Okay. So after that, you need to get admission in OSPAP, and some of the universities of the UK, they also take a preliminary test before granting you admission in the OSPAP. Now, OSPAP, it is only offered by 4 or 5 universities in the UK, and OSPAP, it is not supported by scholarship. So the cost of OSPAP, it is very high. Now, once you're done with OSPAP, then after completing your OSPAP, you have to complete an internship. After completing your internship, that you have to sit in the GPHC exam. And once you're cleared your GPHC exam, then you can go and apply for registration in the UK. Okay. Okay. So now, when we are talking about the clinical roles of pharmacists in the international countries, now particularly for the countries, cost of GPHC is not costly. The OSPEP is very costly. I think so. It starts from £15,000. Its fee starts from £15,000, and in some universities it goes up to £30,000. So that is very very costly. Okay. Okay. Can you guys hear me?
Yes, ma'am. You are audible now.
Thank you. That's why I always tell you to comply with the SOPs, because there was a lot of distortion and host tried to mute something and ultimately I got muted. So, and then I couldn't unmute myself. Okay, so now I was telling you about when you are there in the countries like USA or even in the UK, even you opt for the OSPEP process. So now in the UK, pharmacists they are working as individual prescribers as well. Now and the countries like in Australia and in the USA, it has also passed a law for the individual prescribing. And now in Australia, we have specialty clinics in which pharmacists they can provide the specialty services. And ultimately, once you are there, you are registered. Then you have a lot of career opportunities, career growth opportunities. Now, these are some clinical subspecialties that are very important if you wish to work with a very huge pay rate and being a very important, you can say, member of very important clinical teams. So the ambulatory care pharmacy, cardiology pharmacy, critical care pharmacy, emergency medicine pharmacy, geriatric, pediatric, and pregnancy and lactation, then infectious disease pharmacy, nuclear pharmacy, nutrition support pharmacy, oncology, pediatric, and psychiatry pharmacy. Now the particularly these are the subspecialties. Once you are done with your registration process and you are there, now most of the people from who are there, and like I will tell you with the example of Australia, so they demotivate the rest of the people that there are salaries very low and the cost of living is very high. So they are what they are just sticking themselves towards that one table job. They are not emphasizing on improving their clinical skills. So now to work in a hospital, clinical or community site setup, you need to do what? You do need to go and do MPhil and PhD and these types of qualifications. All of these countries they offer short-term courses like 3 months, 6 months, 9 month courses, and you get enrolled in one of the courses. choose your subspecialty and try to do what? Try to do more and more certifications and hands-on training in those fields. And once you are done with all of those things, then you will be a very important and critical part of their healthcare setup, like in the vaccination centers, in the weight loss management clinics, in the fertility management clinics, in the setups, then in the smoking cessation, then in the detoxification centers, then in the chemotherapy centers, then in the antimicrobial stewardship program. So if I try to name every subspecialty, it will take like more than 1 hour. So this is the global perspective of your degree, just with the simple Pharm-D. No more MPhil, no more PhD. So if you don't see yourself as a very good researcher, or if you don't see yourself as a very good teacher, so then you should do what? You should focus on your Pharm-D degree. You should improve your skills, improve your knowledge, and particularly when you talk about knowledge, you improve your understanding of the concepts, and pick one subspecialty and try to polish that subspecialty. Okay, and we as just Pharm-D holders, we are not just Pharm-D holders, we are custodians of medication, and we are dealt as custodians of medication internationally. So we need to do what? We need to prove our knowledge and our skills. So all of them we can do with what? With the best preparation of our exam, and then after the best preparation of our exam, our communication skills, how we communicate with people, even they are employers, they are patients, they are doctors, they are nurses, and even so these are the things, these are the skills on which you need to work on. Now a lot of students, they are asking about the exam syllabus. Now for overall overview of the syllabus of almost all of the registration exams is what? That the main emphasis, you can say that more than 60% of the emphasis is on the clinical side: clinical, therapeutics, pharmacology. So the core relationship between pharmacology, therapeutics, and clinical side, it is very important. Then the second most important aspect is the biopharmaceutics. Then after biopharmaceutics, we have a small portion of pharmaceutics as well, we have a small portion of pharmaceutics as well. But remember, they don't ask about this is the definition of emulsion. No, they will correlate that this is the suspension, and now the nurse is going to administer the suspension to the patient. What would you counsel the nurse to how to administer the suspension? Okay, so these are the things. Then biopharmaceutics, this is the volume of distribution of this drug. Now this drug is given at this time, now what will be the half life, or so and so. So everything, every aspect, it is correlated. So for the exams, if you need to clear your exam in your first attempt, so you need to do what? You need to understand the correlationship between these core subjects of our pharmacy, that is pharmacology, that is taught in second year and third year. Then clinical pharmacy or therapeutics, that is taught in fourth and fifth year. Then biopharmaceutics, that is taught to us in fourth year, and the basics of pharmaceutics, and a little bit about medicinal chemistry. So these are the basic, very important aspects that you need to correlate. And when I talk about pharmacology, so it does not, pharmacology, remember, it does not only starts with the drug. Pharmacology starts with what is going on in our body. So basic knowledge of physiology, and then the pathophysiology, and the correlationship of physiology with pathophysiology with therapeutics. So once you ace all of these understandings, then any of the international exam, whether you apply for a Gulf country or you apply for any English speaking country, any of these exams, you will be easily acing those exams. Okay, and that is why we hold a distinction as AS Global Healthcare Academy, that all of our students who have appeared in the international exams, they have cleared their exam in their first attempt. So we till the day we hold 100% success ratio. So we don't give the memorize study materials to memorize. We discuss the concepts, we interrelate the things, and then we do what? We take the mock tests and each and everything. But the main focus is not only on memorization, it is also on the understanding and correlation of the things. So this is the thing. If you ace on in understanding and correlating the aspects, then you will be able to cope up with any kind of exam on your first attempt. Okay, now I Please, if you have any questions, do share. Okay,
Uh,
so if you guys don't have any question, so
Assalamu alaikum. Hello.
walaikum assalam. Yes, yes, walaikum assalam.
Yes, yes, Afifa. I would like to have two questions.
Sure, sir.
So let me introduce myself briefly. I'm Dr. Abdul Basir, and I'm assistant professor at Hazara University. And I think I am senior to you by 10 years. I'm also graduate of University of Peshawar. Um,
Yes, sir.
uh, yes, I am graduate from 99 to 2003. This is my session. So one question is regarding the age constraint. Do you think that on all these international exams, is there any age constraint? Like, for example, I'm 45 years
Uh,
old, so can I apply for these exams?
Yes. Okay, sir. As per the exam is concerned, you can apply for exam. But as per
Okay.
the migration laws are concerned, so if you are above 45 years of age or 45 or above, so with Australia, if you know, have a general idea that if you apply for Australia, so you need to go and get some points. So there is a scoring table. So in Australia, there is a limit that if you are above 45 years of age or 45 or above, then you will not get any points for your age. Like the people who are in between 24 to 34 years, they get 30 points for their age. So that might affect your scoring. But as far as the Ireland is concerned, so their age, their immigration system does not have this particular part.
Okay, thank you so much.
And is there any other question, sir?
To be honest, I didn't. I forgot the question which I had in my mind. But
That's
that's it.
fine, sir.
Actually, I would recommend. I have spread your message on my student WhatsApp group, and I think some of students are there from Hazara University. I am seeing some guys who are there. But it was. I really appreciate your efforts, and this is a very good, very excellent. Initiative that you did it for the students, especially the students are frequently asking what is the scope of pharmacists abroad in Australia, in like in US and other countries like so mostly these questions are the students are questioning us, and we don't have that exposure of the international. I mean, we don't have the orientation in these exams, for example. So this is a very good
Yes, sir.
which you presented, and in the future, hopefully you will also you will continue this struggling. I really appreciate
Yes, sir,
your
it's
efforts. Thank you
been
so much.
quite a hectic journey, but now, Alhamdulillah, I have a very, very hardworking and very, very sincere students with me. And now, with their help, things are getting easier. And I think so. When the first step is always the toughest, and ultimately, things go in a flow. So I have a lot of students. Also a lot of my
Hello,
students are also here.
hello, madam.
Yes, sir. Can you hear me? Yes,
Hello.
yes.
Uh, First of all, I will introduce myself. My name is Mohammed Fayaz. I'm from Peshawar,
Okay.
Pakistan, but I live in the UK. Uh, I am
Okay.
pharmacist graduated from Comstate University, having 10-year experience in community pharmacy. Actually, I talked to you
Okay.
about some days earlier
Yes, I remember
regarding
you,
my future
Fayaz. Yes.
plans. Uh, uh,
Yes.
so actually, I have two questions regarding the PSI
Yes,
exam
sir.
and also the affiliation.
Mm-hmm.
So if we,
Yes.
how can I apply from here, from the UK as a pharmacist? Because I have experience in Pakistan, also some documentation from Pakistan. I also have a master degree from the UK. So it's better to apply from my current residence or from Pakistani residence. One question is that, and
Mm-hmm.
other question is there is some documentation needed from solicitor side. So kindly
Mm-hmm.
guide me on these two aspects.
Okay, first thing that you are already there in the UK, and I have,
Yeah.
as I've already told you, the registration process in the UK is quite costly. So I have a lot of students who are there in the UK on study visa, and now they are applying for the Irish registration pathway. And with the Irish registration pathway is one another aspect is that if you are registered in Ireland, then you are free to work as a pharmacist in Northern Ireland. That is the part of the UK, and then you can easily work there as well. So if you want
Mhm.
to apply for Irish registration, you will be having a work permit of the UK, so attach that work permit of the UK or the student visa or anything like that along with your documents, so that once you obviously you have to go to Ireland to sit in the exam, so then you will be granted a visa on the basis of that you have a travel history, you are already in the UK, so you will be granted a travel visa according to that. Okay. And the
Mhm.
second thing about solicitor you are asking, so uh, as you are in the UK, so for your attestation of the document you have to take an appointment from the Irish embassy in your
Mhm.
area. Okay.
Mhm.
And then you have to go to the Irish embassy, and you have to get your document attested from there. You don't need to go for a solicitor in the UK. Solicitor, only the people who are already there in the Ireland, they need to get their document attested from the solicitor.
Okay, so this mean so I just only need an appointment from the island embassy and go there
Yes.
and attest my documents. Okay, so that's fine. So actually,
Okay.
if you were actually we were discuss about a few months earlier, you told me to I can use my Pakistan residential and also all documentation, but the one critical thing is that
Yes,
if
as
I
far as
use
your
those
recommendations are concerned, you can add all of your documents along with it. But to
yeah
make your application strong standing,
uh,
you have to add
mhm.
also your UK
Yeah,
visit as well.
yeah. So
Okay.
actually, I need to clarification one more thing. So if you, as per law in the UK, if you are
Mhm.
graduated from the UK, you don't have to need OET or IELTS exam for the registration or just only for the documentation process. Is it acceptable
If you are
in
done,
PSI?
yes, if you have done my master's from UK and you have the degree, then you don't need to apply for OET again.
So then I can apply for OET again. No
No,
exemption
you don't
needed.
need to. You don't need to.
Okay. So actually, there, when I read the application detail in the PSI system. So they mentioned that if you are graduate from the UK and you have a degree master from graduated from the UK, you don't need to OET, and also you don't need to give sit in an exam if, just like you said, the committee has been go through you on a pathway first. If you go through pathway first, then you don't need to exam. But most of the chances, if you are graduated from here, you can go to this first pathway. But probably they
Yeah,
can
that is the
go
possibility.
mm, for possibility, but just as far as I know.
Hello.
Yes, but again, with these things, we cannot be sure because they have, particularly for PSI, they haven't set a criteria that if you have
Mm-hmm.
10 years of experience or 5 years of experience or 1 year of experience, then you will be in pathway A. So that is a vague statement from that side. And you can never be sure until and unless you get a confirmation from them. Okay.
Okay, thank you so much for your time. Thank you so much. Thank you so much.
Hello.
Now I have question. Yes, yes, Yalla.
Uh, Ma'am, I'm Jaula. I'm currently a pharmacist in Saudi Arabia.
Okay.
For total document assessment, is compulsory or not? Our second question is that I have also done my MPhil. So it's a required MPhil degree for assessment and not for TOEFL, yeah, for USA.
Okay, TOEFL, it is necessary for USA if you have done MPhil or if even if you have done PhD. Okay, TOEFL is the
Yeah.
first step. If you hold a valid TOEFL, then you will be able to apply for the documentation. If you're and again that what is the validity that it should be conducted in the USA only. Okay,
Yes. Yes. No, I'm asking about
so
first we can do assessment or yeah or TOEFL.
first TOEFL for
Okay.
USA, things are a bit different. So first you have to do TOEFL.
Okay. After passing the TOEFL, then we will go for assessment.
Yes,
Yeah.
and
Thank.
someone is asking about TOEFL or IELTS score. TOEFL overall, there are different scores. I cannot exactly recall them, but the IELTS score, it is overall 7 bands. Okay, so usually I don't recommend students to go for IELTS if they are going for PSI. I recommend students to go for OET because OET is easier, and in OET it's easier to get the score, required score. And if the students are going for the Australian side, so I would recommend to go for PTE because the PTE is the easiest English test that is available. Okay, now another student, she's asking about the Norway. Yes, Norway, previously, like if we go 4 years back, around 4 or 5 years back, there was a lot of Pakistani pharmacists that have moved to the Norway. Then again, same thing happened. A lot of other people applied, their registration was in process, and there was some fake documentations, some fake residential addresses or something like that that happened, that Norway totally banned a Pakistani pharmacist. Now, recently, I heard that in July they have opened up and now they are accepting the applications. But still, till now, I haven't got a very, you can say, a reliable information from a reliable source. So I usually avoid to comment on the things that for which I don't have a reliable information. Now, when secondly, she's asking about that. Can we apply for other family visa for Australia, New Zealand rather than applying for exam? Is it recommended? Now there are a lot of visas that are offered by the Australia and the New Zealand, and yes, you can apply for those visas as well. But along with those visas, remember one thing that those visas, they have their own costs, their own laws and everything. So you need to have a very good understanding of everything. But as far as I am concerned, I am not a consultant. I am basically, you can say, I consult only for the pharmacy and related pathways. So my information, it is limited to, yes, if you apply for registration, then which visas you can apply for Australia or anything like that. So I have that information on which I can guide you if you have any further queries. But overall, family visas and those things, those are not my speciality. So those things, if I don't have any information, so I would rather avoid commenting on those things. Okay, student is asking about that comparison between Ireland test and the OPRA test. Okay, so the Irish test, it is basically it is conducted in 2 days. It is composed of 80 MCQs. Out of those 80 MCQs, 40 MCQs are purely from therapeutics, 20 for pharmaceutical calculations, and 20 from basic pharmacy subjects. Now there are the rest 120 marks. They are distributed in 6 written OSCEs and 6 verbal OSCEs. So OSCEs are clinical and scenario based questions. So for 6 written OSCEs, you have to in one OSCE there will be a long statement, 1 pager or 2 pager statement. But for OSCEs, remember for Ireland, you can use your own BNF. It's an open book type of question. Okay, then they will give you a scenario. This is the patient, this is the dose, this is the lab value, this happened, that happened. Then you have to correlate it clinically. Then for the written OSCEs, so they will give you dummy patients or the dummy doctors, and then they will check that what is the knowledge of your Irish law, what is the knowledge about your community, and all of those things. Now when we talk about OPRA, so it is now composed of 150 questions, and those questions, again, they are statement based, long questions, clinical based questions. And then now OPRA, its score is done through AI module, Roche methodology. Now it's not like that one question will carry 1 mark. So the questions that are highly related with therapeutics, they can carry 2 or 2.5 marks. And the questions that are less related with therapeutics, they can carry zero point 0.5 or 0.75 marks. So this is the overall.
Assalamu
For
alaikum.
Gulf, they Yes, walaikum assalam. Just give me a minute.
जी,
Last question I would
ओके,
like to address. So for Gulf, they require recent experience. For if you are applying for Gulf and if your experience is older than 2 or 3 months, I think so, they will not accept that in that experience. And there is no age limit for Gulf. Yes, Hira.
ओके, यस, मैं ये सवाल करना चाह रही थी कि आई एम 35 ईयर ओल्ड एंड मेरा एमफिल हो चुका है और अब मैं करंटली पीएचडी कर रही हूँ। तो क्या इज इट बेटर कि मैं पीएचडी या स्कॉलरशिप्स के लिए पीएचडी या पोस्ट डॉक के लिए आगे परसू करूँ, क्योंकि वो ज्यादा बेहतर होगा स्कॉलरशिप्स पे अगर मिल जाए किसी भी कंट्री के लिए, क्योंकि इटली और जर्मनी में बहुत ज्यादा स्कॉलरशिप्स अवेलेबल हैं। मैंने अभी अप्लाई नहीं किया है बट आई नो कि ये थोड़ा इजी पाथवे है, या हमें इक्विवेलेंसी एग्जाम वाला पाथवे अडॉप्ट करना चाहिए।
Okay. Hira, to be very honest, I have a lot of students who are there already on the student visa. But when you are student visa on your student visa in any country, then ultimately you know that if you don't secure a good job over there and you don't convert your student visa to into a work visa, ultimately you have to return to your home country. So if you want to pursue that pathway, so that is a 50-50% pathway that after completing your PhD, either you will get a job there or you will have to move back. Okay. And if you don't want to risk that, so then go for the safer pathway. That will be that will take I think so it will take longer time, but the cost will be less because study visa, if you don't secure a scholarship, so it is costly. But ultimately you will be moving on work permit and that will lead towards PR. So that is if you want to have a secure future for you, for your family. So this is, I think so, it's the safer pathway. But rest, it's up to
Okay.
you because if you, yes.
So my additional qualifications will help in getting a higher score or not, like MPhil and PhD?
If, as far as this Australian pathway is concerned, so if you are done Pharm-D or if you are done MPhil in pharmacy, so you will get, I think so, 15 points. But if you hold PhD in pharmacy, then you will get 30 points. Okay.
Sure.
So
Okay.
MPhil is
Thank you
not
so much.
get, giving any benefit. Okay.
Okay.
Yes. After FPGE, pharmacists they need to cover internship hours. I think so. These are 1,570 hours, and those internship that is paid. Okay. Misbah, for ECA you don't need any experience.
अस्सलाम वालेकुम
Walaikum assalam.
मैडम, मेरा नाम वकास अहमद है, हज़ारा यूनिवर्सिटी मनसेरा।
Okay.
तो मैं दो क्वेश्चन करना चाहता हूँ। पहला क्वेश्चन ये है कि ये जो सर्टिफिकेट होता है किसी भी काम जो काम करते हैं ना उसके सर्टिफिकेट मिल जाता है, तो इसका इसका कोई रूल है बाहर मुल्क जॉब में या नहीं है?
Okay, certifications as far as they are concerned. So, if you get certifications with the good bodies like WHO and a lot of Harvard and then Coursera or all of these forums that are providing online certifications that hold a value. If you go get those certifications, yes, they help you a lot. Okay, those certifications are important. But recently there are a lot of forums that are giving certifications. So whenever you are applying for a certified course, particularly if you are paying for a certified course, so go and check that whether that certificate it does hold any value or not. So don't waste your money. And particularly a lot of courses from Harvard, a lot of courses from Cambridge, these universities they are also free of cost. So if you want to go for certification, just gather the information and then go do certifications. Yes, the certification will do help you a lot, particularly the certifications in antimicrobial stewardship, then infectious diseases, and then these cardiovascular and all of these hot topics in pharmacy. So these are very important. Okay.
दूसरा क्वेश्चन ये है कि अगर हम डिग्री कंप्लीट कर ले Pharm-D का, तो उसके बाद हमारे लिए एमफिल बेहतर है कि हम एमफिल कर ले या डायरेक्ट जॉब की तरफ चले जाए, तो कौन सा हमारे लिए बेहतर है अगर हमको स्कॉलरशिप मिलता है बाहर मुल्क का?
ओके, अब ये तो आपकी अपनी चॉइस है, ठीक। इफ यू वांट टू परस्यू योर करियर इन एकेडेमिया इन रिसर्च, देन गो अहेड, डू अ मास्टर्स, डू पीएचडी, डू पोस्ट डॉक्स। But if you don't see yourself as a good researcher or a good teacher, then don't waste your time. Try to go for job and try to get experience from the job, and then just gain experience over there.
वन मोर थिंग मैडम, इन्हीं की क्वेश्चन से मुझे एक चीज याद आई है, जो बीसीपीएस के सर्टिफिकेशंस आजकल बहुत ज्यादा लोग कर रहे हैं, उसका क्या कोई स्कोरिंग वगैरह में कोई फायदा होता है, या वहां पे जॉब हासिल करने में कोई फायदा होता है बीसीपीएस?
Yes. BCPS and ASPH, these certifications are very good.
Okay. Any field, any subspecialty.
Yes, in any subspecialty, that depends on your choice.
Okay.
Okay, someone has asked a question about that. Walaikum assalam.
Dr. Fifa, how are you? My name is Dr. Malik Shoaib, and I'm a pharmacist, registered pharmacist from Pakistan. And I have done Doctor of Pharmacy from session 2013 and 19. And after that, I have done certain certifications from International Diabetes Federation and International Society of Peds and Adolescents. So I have 5 years of experience, clinical experience of treating diabetes, both type of diabetes, type 1, type 2, and GDM. So I want to know about it, that how much they help me in getting the international visas, or so kindly guide me. I have experience, but I don't know what to do now.
Okay. So it depends on the country. So if you are going for Ireland, so you hold a 50-50% chance that upon your, depending on your experience and everything, they might uh, uh, exempt the exam from you and you will be directly placed in pathway A. But that is not for sure. And as far as the rest of the countries are concerned, so you have to register, sit in the registration exam. Yes, the benefit you will be getting from your hands-on experience, then once you are there and you are practicing, so you will be having a better knowledge as compared to your competitors, and that will help you in your career growth. Okay.
Okay, ma'am. Thank you so much. So, what would be the good option, the European countries or the Gulf countries for me now?
Okay. Again, that is depending on your situation, current situation. If you have a good budget and if you can wait, okay, because European countries or English countries, they take a lot longer than that of Gulf countries. Then go for the European countries. But if you have budget constraints and you want to make a quicker decision, then go for the Gulf countries.
Okay, thank you so much, ma'am.
Yes, Samreen, inpatient pharmacy jobs and IV preparation certifications. Yes, everything that is related to the clinical side, that is important. And someone is asking about the documents for FPGE and everything. I don't exactly memorize the list of the documents. So if anyone wants to take the details with me, they can check on with me. But I will surely respond to all of you. Okay. Someone asked about the scoring system. So there is a scoring system that is applied in Canada and in Australia. So like when you are applying for the visa, okay. So you will be given some scores. Like for your age, there will be some score. Your English excellency, there will be some score. From your exam, there will be some score. From your experience, there will be some score. From your education, there will be some score. So overall, then it comes towards a score. So mostly nowadays, if your overall score for Australia is above 85, then there are very bright chances that you will get a visa from the state. So there are different sets of visas, state sponsored visas, then there are other employer sponsored visas, different kinds of visas. So that is something that we can discuss once you are done with your exam and everything. So that is the point that we will be discussing at that time. Okay. Okay, sure. The recording, it will be uploaded. And Rizwan, please share the link of the YouTube channel in the group. And at the end of the this lesson, I will also send the link of the official AS Global Healthcare Academy group. You guys can also join that group. And after once you're done joining with that group, so I will dissolve this this particular group. Okay. So yes, recording is available. Recording will be uploaded on the YouTube channel, and link will be shared with all of you. Okay. And rest, you have my both number. Yes, for Oprah exam, I have provided you all of the details, and rest, if you need anything, personal consultation, so you can just send me a message, and in my free time, I will do give you a call. I really like to counsel the students over call, and then I will help you, all of you, as far as I can. And my number, both my Australian number and my Pakistani number is there in the group as well, and it is here as well, and you can talk to me. But just remember that if you approach me, please give a brief introduction, so that you stay in my mind, because this hi, hello, this just skips my mind. Okay. It was really nice talking to all of you, and thank you so much for an immense response. And hopefully, in future, we will continue more and more of these types of webinars, and we will keep in touch.